We need a hand for Sandi Radomski. Okay. Sandi is one of my favorite people. I met her early on as these things were unfolding, and you specialize in allergies, substance sensitivities, but you were doing this before EFT, and I think even tapping ever came along. Were you not?
Yes, I was in 1989.
It's okay. Go ahead.
I'm okay. In 1989, I met my husband, who's an applied kinesiologist, chiropractor. So I started going to a lot of the chiropractic seminars, and so I learned muscle testing and allergy work before EFT.
Sure. And I think at the time you were addressing some points, acupuncture points on the back, the spine, and others on the earlobe, which you were doing with a laser device.
Well, actually, that came later. What I was doing originally, I'm sure a lot of people are familiar with NAET, which was Nambudrapad's allergy elimination technique.
Yeah, not everybody would be, but you just described it, so go ahead.
Okay, and that's actually, I was doing that, and I guess I was going to just talk about the story of what happened at the Ultimate Therapist. Is that
As
okay?
you will, go ahead.
Okay, so I had been doing the allergy elimination where I did tap down the spine. Actually, at that point, I was tapping down the spine like this. And that's what I did for people who had substance sensitivities. I would treat down the spine. And when you're going down the spine, you're treating on the bladder meridian, and you're balancing the body in relationship to things on the bladder meridian. And the bladder meridian, everything on that meridian refers to the other meridians of the body. So I do that with my substance sensitivity patients. Then, when when there was an emotional issue, I do EFT, and I do tapping on these points. And I kind of had them separate. And then one day, it was the day before your Ultimate Therapist seminar in San Francisco, I was driving home from my office at about 10 o'clock at night, and I'm in Philadelphia. I'm leaving the next morning for San Francisco, and I'm talking to my mother on the cell phone, and she's in Chicago. And she had a cough, and the doctors finally said the cough is from her blood pressure medicine. But she couldn't stop taking her blood pressure medicine because it was really dangerous. But she was going to have cataract surgery about 4 or 5 days later, and she was just told she can't cough. So I'm in the car, I'm in the cell phone in Philadelphia, knowing there's no way for me to get there and tap down her back. And what am I going to do? And I'm like, driving the car and trying to think. And I said, okay, Gary says use EFT for everything.
Try it on everything.
Okay, well, I told her, go get your medicine. I went and had her get the blood pressure medicine. And then on the phone, I tapped, I went through all the points. I had her write it all down. And she's an accountant, so I knew she'd follow through and be real specific. And so then she went through it, and then I told her she needed to do that for the next couple days. So then, next day I get on the plane, get to San Francisco, I call my mother, and her cough is 50% better. And then I had her tapping some more, and like the next day, her cough was gone. And I went to you, and I told you that, and that's how I ended up, getting on the stage and talking about what I had. It was the first time, yeah. And now it seems simplistic to say, of course you're going to tap for a substance sensitivity just like you tap for anything else. But at that point, I had not seen the connection between going down the back and balancing all the meridian points from the back, or balancing all the meridian points from here. So it was like an interesting aha.
As a result of understanding, what's going on with the back, I have on occasion with people just tap. It's almost like a back rub, and a massage therapist can use this beautifully. People can lie down on the massage table, talk about their issues, and during the massage, you just start massaging these points, tapping these points, whatever. Right. And the client doesn't even know you're doing EFT or anything like that.
Right.
So it's interesting. Also, you and I didn't discuss this too much, but it's been my experience that allergies often come from unresolved emotional issues. And if you can discover that, what the unresolved emotional issue is, and then resolve it, then the allergy seems to lift. In fact, one of the things, I don't know if you do this or not, I know Alan Handelsman does it, who's also a specialist in the same field. He will ask somebody, when's the first time you remember having that, this cough or this allergic reaction? And they'll say, once upon a time when my parents got divorced or something like that. Okay, you go back there, you start resolving those issues, and next thing you know, the allergy dissipates. I gather you've had experience like that.
Right. One of the things I do, and it's in my manual, is I call it the emotional sensitivity treatment. And what I do is I find something that they're reactive to, a problem substance, and then I find out which emotion is connected with that substance. And then I do this thing where I go back in time and find out when that started. And then I clear the emotion. I don't clear, I usually have them holding the substance, but I'm not saying anything really about the substance. I'm mainly talking about the emotion.
Sure.
And then it clears the substance also.
Okay. I'm going to leave in a minute, but I want everybody to know that you are a former stage fright victim.
Oh.
Is that not correct?
That's right. Gary asked me if I was nervous, and I said, I want you to know this is a testimonial to EFT, because I was the shyest, most frightened person. I wouldn't, in graduate school, I couldn't even talk in front of 5 people. I just couldn't talk at all. I had to make myself talk. I'd write, like, I have to do 5 times. I'm going to talk. I'm going to talk. I was so frightened of talking. So
today you have
is a
175.
Right.
Okay, I'll leave it to you. Thanks, Sandi.
Okay, thank you. Okay, well, I am going to be using this, so if people can see it, it's a little bigger, so I hope most people can see my overheads. I am so happy to be here to talk to you about how I work with allergies and substance sensitivities. And like Gary, what we were talking about, I've been doing this for at least 8 years, probably 10 years. I've been working with the substance sensitivities. And let me said some of the things I already was planning on saying. So that one of the things Gary wanted, when I first talked on the phone with Gary, oh, okay, I got to keep it down. Okay. Is that one of the reasons it's so important for us as therapists to be knowing about substance sensitivities is that often the complaint that you're seeing is actually caused by the substance. The actual emotional or physical complaint is due to the allergic substance. So not only does it interfere with our treatments, but it's really important because you could be tapping on something forever. And when the issue is something you're exposed to, it's not going to go away. One of the examples I have is that last summer I was teaching at Oxford. The ASAP conference was in Oxford. And I was doing a 2-day pre-conference, and this woman came up to me in the morning break, crying, sobbing, in a panic attack, saying, I have to leave, I can't stay here. And I said, well, that's fine if you can't stay, but can I please muscle test you? And she let me muscle test her. And it's been my experience that often panic attacks and real bad anxiety attacks are from detergent, the detergent they're wearing on their clothes. It's a real common one. So that's the first thing I went to. And I had her smell her T-shirt, and I muscle tested. It was very, very weak. So I treated her, and for her the detergent on her T-shirt. Now, it could have been the material of the T-shirt, but most people it's the detergent. So I treated her for that, and then I happened to have a room upstairs, and I just ran up and I got a different T-shirt and I put it on because sometimes you need to avoid things for a while, and here it was right on her. And she put on the T-shirt, and she was able to make it through the whole next 2 days fine. Now, she had said she was a tapper, and she had been to many, many healers, many therapists in the last few months, and she'd been having these terrible panic attacks over and over again. And she said, which was so interesting, she said, it feels like it's following me around. Well, you know what it was? It was on her. And the other thing she said is, my bed that used to be like my refuge, my place of comfort, isn't a refuge anymore. Well, if your detergent is giving you a problem and you're sleeping with your head in the pillow and surrounded by the detergent, you're going to be having a lot of severe problems. So she was totally able to make it through that training, and when none of the other tappings had worked before, she would feel better for an instant, but it would come right back. So it's important to know that sometimes when people are coming in, that's the aspect to really tap on, is the substance sensitivity. The other, I'm so used to pushing that up. The other sort of classic idea of dealing with substance sensitivities is that it improves the effectiveness of your EFT treatments. And I had one of these cases really early on, and I think I was doing TFT at that time, actually. And this man came in, and it had been about a year since his mother had died. And he was still grieving, and he couldn't really function. He was not real functional. So I started doing the tapping, and he didn't get better. And it's like, you know, this is such an effective work that we're all surprised when it doesn't work. I'm assuming you are too. So I was really surprised. I said, what is going on? What is going on? And what I ended up doing is then noticing that he had a pack of cigarettes in his pocket. And I asked him what his mother died of, because I hadn't asked before, and it was from lung cancer. So I thought, I'm going to see about this. So I had him take the cigarettes out. I checked him on the cigarettes. He was very weak on it. I threw it across the room, and then we were able to tap, and everything went away. So taking that, I didn't even treat him for that at that time. Just taking that away from him, being not in the presence of something that he was reactive to, gave us a window of opportunity in which we could then do the effective EFT treatment. So those are the reasons that we're going to be wanting to do this treatment. I think this is in a different place than it usually is. There's really 3 steps to using the EFT for energy toxins or substance sensitivities or allergies. Those 3 words I'm going to be using interchangeably, by the way. I consider them all the same. It's really anything that is going to weaken the system. So the first is to determine whether a substance sensitivity may be contributing to the symptoms or interfering with the EFT treatments. If all you do is start questioning, is there a substance that may be causing this problem, you will have done a huge service to people. If you begin to start noticing or have parents notice, does the child have problems in school only when they have pancakes for breakfast rather than having eggs for breakfast? You have changed that child's life. You have changed how the teacher is going to view the problem, how the parents view the problem, and how the child views themselves. So if you get nothing else from this talk but opening your mind to the possibility that an allergy could be causing somebody's symptoms, then I'm happy that you got that. The next step would be to use detective work to identify the possible reactive substances. So we're going to be talking a lot about detective work and what we can do to identify the reactive substances. In my office, I use muscle testing. I don't know how many people here are familiar with muscle testing? Oh, good. Okay, good. So I can use it here. Gary had sort of wanted me to gear it to not using that much muscle testing. So I have ways besides doing the muscle testing to help do the detective work. But I'll use the muscle testing up here because that's the only way I can really identify a change at the moment. So if you use the muscle testing and the detective work to identify the possible substances, then the person can avoid it. For instance, I had a patient who came in and she had a night cough, and this cough kept her up really badly. I mean, she had gone through numerous medications, and she still was up all night coughing, and it was really affecting her life, and she was very frustrated, very upset. The doctors didn't know what to do, and she came to me, and I did some testing of substances, and it turns out when she ate wheat, she would cough. If she didn't eat wheat, she didn't cough. So she didn't even care about getting treated on it. She just felt so much better knowing that she had control in her life. She knew if she wanted a bagel, she'd cough that night. But if she didn't want to cough, she knew what to do. And just giving somebody that kind of power and control in their life is wonderful. If somebody gets depressed when they eat something, and they know they can not be depressed by not eating it, you've really helped them a lot. So just getting to the point of knowing what to avoid is again, really, really helpful. But sometimes it's very difficult to avoid, impossible, undesirable, or even dangerous to avoid certain substances. It's pretty difficult to avoid mold or formaldehyde or dust, those kind of things. It's impossible to avoid metal that's been implanted in your body. And you'll see that's one of the things I've been working with, is people who have metal in their body. It's impossible to avoid that. The other thing is if it's undesirable to avoid something. Well, if your dog is the thing you're allergic to, you don't want to have to give your dog away. So it's undesirable. And sometimes it's really dangerous to stay away from certain substances. Somebody, and I don't know where she is, just came up at lunchtime, and I was sort of muscle testing some things that she was allergic to, and it was one of her vitamin pills, which was like this multivitamin with all this good stuff in it. Well, she's reactive to some of the, and many people are reactive to vitamins and minerals. And that's dangerous to stay away from those kind of things. So when it's either dangerous, impossible, difficult to avoid, then you go to the treatment part. And that's what we're going to be doing. We're going to be using EFT to reprogram your body to no longer react to the substances. And once you get to the reprogramming, you've really changed somebody's life. So, regardless of what Gary's saying about me, there are many, many people who have treatments for allergies. It's not just me. There's many chiropractors, there's many acupuncturists that have trainings to deal with allergies. I mentioned Dr. Devi Namboodrapad. I always mention that I'm very indebted to her and her work. She did a wonderful training. For years, people asked me to teach, and I said, no, go take Dr. Devi's work. And for years, people did that. And then recently, she is no longer letting therapists into her training. You have to be a medical doctor, a chiropractor, or an acupuncturist. And so that's how this all happened. I felt it became my mission to share this with other people, to share it with therapists, because we're the frontline people who are dealing with the emotional, physical problems that are caused by substance sensitivities. So that's why I'm doing this, and I've just started the next step, which is really going right to the public, and I hadn't done that before. So I'm real excited about that. So, even within the energy psychology field, there's a lot of us that are doing allergy treatments. I mean, Tapas has a treatment for allergies, Asha Clinton has a treatment, Alan Handelsman has a treatment, Fred Gallo has a treatment. So there's lots of people doing things. What I see as my niche, and what I hope I'm going to be able to impart to you, is to help you think about allergies in a way that then you feel comfortable integrating it into your practice. The treatment is really, really easy. You already know it. You already know how to do EFT. It's basically the same treatment. In normal EFT, you think of a negative substance. By thinking it, you're putting it into your energy field. And what the hypothesis is that causes a disruption in your energy field. You continue to think it while you balance the body in relationship to that substance. It's exactly the same as what we're going to do today. You're just going to use a substance instead of a negative thought. And you'll hold the substance and continue to hold the substance either in your hand, in your thoughts, on a piece of paper. You hold it in your energy field while we do the EFT to clear any problems with it. So you've got the treatment. The trick is knowing what to treat. So that's what I'd like to impart to you. And my goal for today is that you're going to feel comfortable using this technique, using this kind of work with yourselves, your family, and your clients immediately. Okay. So let me just tell you how I got specifically involved with the allergy work. And this, was kind of like Larry had a personal issue, and this was with my husband, is how I got involved. My husband had an ear pain. I mean, this really bad ear pain for years and years. And he's an applied kinesiologist. He tried every alternative treatment. He tried every traditional treatment, and nothing really worked, but he could manage. Then we went to one of his seminars down in Florida, and we were in West Palm Beach, and we had just gone in the hot tub, and we got back to the room, and all of a sudden he's writhing in pain. He's like on the bed going like this. And he's going, we got to leave. And my husband loves seminars. And this was the start of a 4-day seminar, so I knew something was really bad. And I tried tapping on him. I had just been to Callahan's $5,000 training. So I'm tapping and I can't get anywhere. And one of the things when you go to his big training is you get consultation on the phone. So I thought, aha, I'm going to use this. So I called him on the phone, and he put Bob on his $100,000 voice technology machine, and he had him smell his sweatshirt. He had a sweatshirt on, and he said he's allergic to a sweatshirt. Take it and throw it across the room. And so he did that, and then he came up with a sequence. I got off the phone, and I did the tapping on him, and he was much, much better. But, he said, I felt better as soon as I took that sweatshirt and threw it across the room. And it was the first time we knew that this was connected up with an allergy. We would have never guessed this dagger-like pain in his ear was an allergy. And so that's how we began. And we came back. What happened is we started muscle testing everything because we could muscle test. He was allergic to everything. He was allergic to books, pens, paper, all the linens, and all our clothes. It was really, I couldn't even be near him with clothes I had washed from home. So I got to get all new clothes, which was great. But it was terrible. We went to eat at an IHOP or something, and he couldn't take the colored little placemat in front of him. We went on a walk by the ocean, and we sat down on a bench, and it got worse all of a sudden, and we realized there was a newspaper in the garbage can next to the bench. That's how bad he was. So now we knew what the problem was, but he could not have a life, and he couldn't practice, his profession with that kind of problem. He couldn't be near a pencil or pen. So when we came back, we found somebody who did a couple treatments on him doing the NAAT, and then we flew out and we learned the work. And then what I'm doing now and what's in my manuals is putting together many different people's allergy treatments, and then some of the ones we've put together ourselves. And he's come up with some treatments, and I've come up with some treatments, and they're all in the manuals. By the way, I've had a lot of people ask me this. The first manual, the pinker one, is my basic manual that has my first 5 basic treatments, and this is the basic manual. I put together the advanced procedures manual. I've got so much stuff up here. Because what I found was that I was teaching a lot more things in my seminars than I had in my basic manual, and I wanted it to be available to everybody. So this really takes off from the first manual. It's sort of a continuation rather than a substitution. And I have just a little bit of review in the beginning, and then the rest is all new material. So as you can see, my first involvement, well, it wasn't really my first involvement, but the real importance, personal importance of the substance sensitivities was through Dr. Callahan. And what he did is decided that when the TFT wasn't working, you were often exposed to an energy toxin. And that is his word that he coined, meaning that anything that weakens or is toxic to the body's energy system. And like I said, that's basically what I'm talking about. I know I use the word allergy, but it's just a sort of a handier word to use, I think. It's not necessarily a histamine reaction. That's the important thing to know. This is really more the definition of allergy that I'm using, and this is from Doris Rapp. An allergy is an abnormal response to a food, drug, or something in our environment which usually does not cause symptoms in most people. So it's kind of a generic definition. And it's important for us, in terms of our licenses and things like that we really are focusing on the energy disturbance and not the symptom. We're fixing the energy disturbance, which then changes the symptom. So this is a wonderful time to be dealing and learning about allergies because there's so many of them. I've had lots of people coming up to me with all these allergic kind of symptoms, people having trouble in the hotel, people having trouble in this environment. There's just been an amazing increase in allergies. So if you put out that you're working with allergies, you're going to have people knocking down your door, really. There's been a big increase in asthma, especially in children. You go to a class and half the kids have little inhalers. It's amazing. More and more people are environmentally ill. The people who come to my office come with masks on, oxygen tanks, and all that kind of stuff. More and more places are perfume and scent free. Because of that, our office is perfume and scent free. And you know, we like wash the floors with vinegar and things like that. You know, we try to do whatever we can do not to have a lot of scents for our patients. More and more people are having difficulty tolerating medication. I bet some of you have had difficulty with that. I worked in a doctor's office for about 6 years, and it got to the point where the patients wouldn't get their prescription filled until they came to me and had it muscle tested. The other thing was the doctor was enough aligned with me that if he had several medications and he didn't know which one to choose, he'd have me muscle test which one to choose. So that was wonderful. But this is very, very important, this whole idea of tolerating medication. Currently in the United States, adverse reactions to prescription medication is the 3rd leading cause of death. So if you can do something to help somebody with their medication, you may really be helping them. So that's a very important position that we could be in. The other thing is now it's really common to have sick building syndrome. When I started doing these talks, no one knew what I was talking about when I said sick building syndrome. Now when I give talks, you know, lots of schools have been you know, closed off because of mold. The last one I just gave, that a town built a new library, and it was a big thing because this is a little tiny town, and for some reason the whole library is filled with mold and they can't use it at all. And this is not uncommon. I live near Wilmington, Delaware, where DuPont is, and they totally evacuated and stopped using a 7-story office building because of the mold in the building. And people were getting so sick from it. So there's huge increases in allergies. And then we start looking at what are the reasons. And the most obvious one is that we're exposed to more and more chemicals all the time. You know, we evolved through evolution for thousands and thousands, I'm not sure if it's millions, but certainly many, many thousands of years. And during that time, our immune systems were learning what's good for our body and what's not good for our body. And now we're having to decide on a daily basis. We're getting all these new man-made chemicals, and our body's having to say, is this good for us or not good for us? And our bodies aren't always able to do that. Our food sources aren't even safe. The bioengineered foods, I mean, the big issue with the bioengineered foods is it causes allergies. And, you know, sometimes they label them now, and sometimes they talk about it, but you know what? I don't trust the system, I'm sorry. Very soon it's going to be all in all of our food sources. I mean, I think it's really moving that direction, and that's scary. Now, allergies increase after trauma, and that is, even the medical doctors agree with that after trauma, there's often an increase in allergies. My classic example that I use is a patient that came to me hardly able to eat any foods. She was getting really scared because she was getting skinnier and skinnier because she couldn't eat many foods without getting really sick. So we started working, and I gave her, I guess it was at that point Dr. Devi's book to read, and she said, you know what? I just realized that when all these allergies to food started, it started when I had been in Germany for a wonderful banquet dinner. It's like many, many courses, all different kinds of foods, all different kinds of spices, with different wines and sherbet between the courses. It was this wonderful meal. And as she was leaving, the proprietor of the place told her, it had just come over the radio that, this was a long time ago, that the United States had invaded or bombed or something, Libya, had bombed Libya. This was a long time ago. But in her mind, her husband had died when he was 25. Her son was at draftable age, and she saw in her mind in that instant that he was going to die in some war. And she fell to the floor, and someone had to pick her up, catch her just before she hit the floor. From that time on, she kept having allergic symptoms to more and more foods. And what was going on is that in inside her when she had that trauma were all these tastes and foods. So they were conditioned so that every time she had that taste, her body would go back into that trauma. So this is a piece that's going to be very important for us as, dealing with the emotional parts. That the trauma can get conditioned with the different foods. And I'll be talking a lot about this. That goes along with the ideas of Robert Ader. He's the one who coined the word psychoneuroimmunology. And I was very privileged in the 1980s to be at a national pediatrics conference, because I worked in pediatrics at the University of Wisconsin. And I was at this roundtable discussion with maybe 10 people with this man giving his first time he was presenting his research. And what he talked about is he had, and I never remember if it's mice or rats, he had, let's say mice, and he injected them, no, he didn't inject them. He had them take a saccharin solution, so something that tasted sweet, and in that solution he put an immune suppressant drug, so their immune system went down. A month later, he just gave them the saccharin solution, the sweet tasting solution, and their immune system went down. On one trial of pairing the immune suppressant drug with this sweet taste that the mouse's whatever body had learned to reduce the immune system. This has amazing implications. What Dr. Ader said was that if you had had pistachio ice cream for the first time, when you had the flu and your immune system was down, every time you ate pistachio ice cream after that, your immune system would go down. So it's very interesting to see the connections between things. The increase in allergies also got worse after 1970. And that's because they started building well, it's in buildings built after 1970, they started building buildings tighter. Because of the oil crisis, they made it tighter to hold in the heat and the coolness, but it's also holding in the dust and the formaldehyde and the mold. So things have gotten worse since then. Allergies tend to run in families, so that you don't necessarily inherit the same allergy, but you inherit the tendency to have an allergy. So that, you might have a respiratory allergy and your child has a gastrointestinal allergy, but the tendency for allergy is really inherited. What I find, which is fascinating, because I see a lot, like I said, a lot of autistic children, every one of those families have lots of allergic components in the parents, and sometimes into the grandparents. So there's a real allergy component to these children. What I think one of the biggest reasons for increase in allergies is the rain barrel effect. And that was a term coined by Dr. Doris Rapp. And it's all about that the body can handle so much. It can take this chemical and this pollen and this dust and this mold, and at one point it just the rain barrel overflows and you get symptoms. And it can be not just present symptoms, it can be past exposures for things. That's why I hear all the time, it's like, I don't know why I have allergies. I never had allergies before. Suddenly I have allergies. There's a subset of people who have allergies as children and they outgrow them, but a lot of people get allergies later in life because of this rain barrel effect. They just can't handle things anymore. So we've been using that theory of the rain barrel effect for years, and then I actually found a study that shows that it's true. What they did is they had people who reacted to dust mites. And they saw how much dust mites they would have to be exposed to have a reaction. Then they exposed them to diesel fuel, which is a known toxin. And it only took 1/5 the amount of dust mites to have an allergic reaction after exposure to the diesel fuel. What that means is exposure to one allergen makes your reactions more likely to another allergen. I think this is the main reason we're having so many more allergies, because as we're exposed to more and more chemicals, more and more fuel, more and more petrochemicals, more pesticides, all of this, we're having symptoms of things we would never have had symptoms before. It just wouldn't have existed. So I think that's what's really that's really happening. Now here's another study which I thought was interesting. This is more of the psychoneuroimmunology. And they took a group of mice and they had an injection of an allergen when they were exposed to audiovisual stimuli. And the other group just had the audiovisual stuff. A month later, whenever they tested again, they just did audiovisual stimuli to the first group who had the allergen put in, and they certainly got a reaction. They even got a histamine reaction. I mean, that's how strong this conditioning is. So when things happen in relationship to scents and foods and colors or things like that, being around those substances, again, are going to trigger all kinds of problems. Okay, so this is real important. Any symptom can come from food and environmental sensitivities. Any symptom can come from an energy toxin. Any symptom. So we're talking about both physical and emotional symptoms. And here are some common ones. Like I said, the anxiety or the panic attack, that's real common with the detergents and other kind of foods. The arthritis is common. Long time ago, actually, I should wear it again. Way before I was doing allergies, I had first I had silver bracelet. I had a silver bracelet that my husband had gotten me from Sedona on our honeymoon, actually. And I wore it every day for years and years. And then it was like, oh man, this is so heavy. My arm is aching. Oh, it's so heavy. Now, how heavy could a bracelet be, right? But I took it off. Okay. And then my wrist was fine. Then I had a silver ring that I wore on this finger. And I wore it, and, I had no problems. And all of a sudden I said, oh, it's so heavy on this finger. I'll put it on this other finger. So I took it off of here and I put it here. This finger got okay, and this finger got bad. Well, what did I do? I realized I couldn't wear silver, but this was years and years before I was doing any of the allergy work. And then I thought back about it. But I could have gone to some doctor and they would have said I had arthritis because I had all the symptoms to it. Some of the other things, kind of cough, depression. Depression's a common one from different foods and different substances and smells. So we're dealing a lot with people's depression, and it could be from some kind of substance. I see a lot of people with digestive problems and who can't eat a lot of things. And when we go along with this, using treating them for digestive enzymes often clears everything up. Dizziness, eye irritation. I've had people who've been reactive to the plastic lens they put in after they have cataract surgeries. And I've just used my little vial for plastic, and we clear them on it, and then it goes away. Certainly fatigue, cold, headaches, hyperactivity. Learning disabilities, that's the whole ADD, learning disabilities, that's a whole area where this is very, very important for the kids. I actually saw on television in the morning, one of these morning news shows, and they were saying it on television. So if they say it on television, it's even a higher amount. They said that they feel that 20% of the people, 20% of children are affected by vaccines somewhere in the continuum from learning disabilities to autism. This is what they're saying on television. Can you imagine what percentage of children are affected by the vaccines? So sort of memory, mental fogginess, aches and pains, sore throats, that's a very common one. And weight gain. I've had numerous people come up to me about weight gain and the allergies. And that's a very significant issue with the allergies. When I went to this Dr. Callahan's training, he handed out a little case study. And in that case study, it was about a man who was 350 pounds. And he had just had triple bypass, and the doctor said if he didn't lose weight, he was going to die. So that's motivation. He stayed on his diet to the T and didn't lose any weight. And he was very upset. And someone muscle tested him, and he was weak or reactive to chicken, pepper, aspartame, which is equal, and corn. Just taking those things out of his diet, he lost 20 pounds in the first 5 days. And then he continued to lose weight after that. my theory had always been that what's happening is the body is seeing those foods as poisons. The body doesn't care if you're heavy or thin. The body only cares that you survive. And if they need to do what it needs to do for you to survive, it will do it. And if that means holding on to lots of water weight just to try to dilute the poison so you can survive, that's what's going to happen. So when people come in who are, and there'll be a lot more on the weight stuff, but when people come in who are wanting to lose weight, I have them write down everything they eat, and then what they'd like to eat also, and we muscle test everything. So they can have an idea of what things are good for them and what things aren't while we're in the process of clearing things, because we can, there's avoiding and then there's clearing, and then we clear a lot of the food so they can eat them. But we want to identify what are the problem foods. I had one person who was, she had a lot of weight to lose, and she was going to Weight Watchers. And she was like, how sometimes you lose a half a pound and then you stay the same, and then you lose a quarter pound and then you stay the same for 2 weeks. It's kind of slow. Well, we tested, and she was weak on lots of things. She was weak on wheat and corn and many, many things. I can't remember everything right now. The only thing she was willing to take out of her diet was wheat. She took that out of her diet, and the weight just fell off of her, and she lost 80 pounds really, really quickly. So not eating the foods that are causing you to hold on to weight can really help. So for us, one of the important things is that emotional symptoms can actually be an allergic reaction. So I've got a few examples. The first is a 12-year-old girl who, this was written up in a journal. She was just normal, sitting there talking to people, and they exposed her to 3 molds. And it was Manila, endodermophyton, and trichophyton. And as soon as she was exposed to these molds, which aren't that uncommon, we're all exposed to molds all the time, it took 4 people to hold her down. She was kicking, screaming, biting, and everything, and that was all from being exposed to mold. I have another patient who's an RN, but most of her adult life she was in and out of mental hospitals. And she was really, and she never made sense to me because she was really fine when she wasn't in the hospital, and then she'd really be in a bad way and she'd end up in the hospital. And we started talking, we're doing the detective work, the history, just what's going on, when did this happen, when did that happen. It turns out that all of her hospitalizations happened after dental procedures. And she had dentures from very young. So she was always having like yeast things or this thing going on, and they were always giving her fluoride treatments. She was very reactive to fluoride. We cleared her on her dentures and the mold and anything that's underneath and all this stuff. And after that, now it's got to be at least 5 years, maybe 4 or 5 years, she has not been in the hospital again. But before that, every time she had a dental procedure, she was her whole life had fallen apart with this. Another patient I have is, she's a psychologist, and she knows all the tapping, she knows muscle testing, and she related the story to me of going to the grocery store, feeling fine, feeling wonderful, and then walk down that aisle with all the smells, the detergents and all the stuff. And she said by the end of the aisle, she was angry, scared, upset. She just was terrible. And she muscle tested herself and realized that it was being caused from the smells. And then she did some things to kind of balance herself. But if you think about it, someone else feeling angry or upset could have been angry at the kid that was with them, or their husband, or their boss, or they could have felt so frightened that they'd never go to the grocery store again. All because they were reacting to the smells. My last example is my sort of favorite one is Susie, and she was 22 or something, this bubbly, blonde, really cute young woman. And she came in, and she just looked fine, But her problem was that from day 15 of her period, or menstrual cycle, till her period, she cried constantly. She missed several days of work each month, and then the other day she sat at her computer at work crying. So, lost my train. I thought the 5 minute, oh, it is, I saw peripheral, something happened. Oh, that was the 5 minute, okay. Okay, so here she was. She cried all the time, so everyone wanted to put her on Prozac, right? And she didn't want that, so she came to me. And the first thing you think about with something with the menstrual cycle is something with her hormones, right? So I checked her on her hormones, and I cleared that. Didn't seem to make a whole lot of difference. But then the next session, we were talking about foods, and it was like at the end of the session, and we were checking foods, and we got to wheat. And she was very reactive to wheat. And she says, oh, well, I just won't eat any wheat this week. Came back the next week, all smiles, because day 15 of her period had come and gone, and she didn't cry at all. And the only difference was she didn't eat any wheat during that week. That's a tongue twister. And she didn't care if I treat her. I did treat her. But she was so happy, she felt like her life was totally changed. By just not eating a certain substance, she didn't have this crying for 50% of her life. And her fiancé was very happy also, I must say. So what we're talking about then is a change in perspective when you have an emotional symptom. Besides the normal things we do, we also want to say, let's see if there's a substance that might be triggering this problem. So when someone's upset, you will ask them what they have eaten, what they've smelled, what they've touched, what activities they were in, and in what environment they were in. So it's just different kind of questions that you might ask along with your normal questions when someone's upset about something. Because if it always happened right after they left the stable where they went on their horse and always got depressed after they left, it could be from what's going on there. Oh, well, I can't find the one I want. Okay, here's the one I want. So, this is just important that what Dr. Callahan says is the more severe the pathology, the more allergic reactions. So that what he says is that the people with the most allergies are going to be in mental hospitals. So some of your patients who come in with the most problems probably have the most reactions. And that may not mean that every one of your patients who are having difficulties have these sensitivities, but it's certainly something to check. And I don't know if I'm going to put money on it, but I would bet that most of the people who you have the most severe symptoms have more of the severe allergies. If for nothing else but the pairing of traumas with foods and things in their lives. Okay? I have 10 to, and it's 15-minute breaks, so 5 after 3, we will meet here again. What I wanted to do was show you some of the things that happen to children after they've been exposed to different substances. These pictures are from Doris Rapp's book called The Impossible Child. And she's a wonderful woman, by the way. Are people familiar with Doris Rapp? Well, for the people who aren't, she's the pioneer of connecting up allergies and allergic reactions with children's behavior. When she was on Phil Donahue's show, she had 180,000 responses from her show. And these things are from her book. And I guess I'm so excited I have to say it right now. So that this is her treatment. She used to do a treatment where she did a homeopathic injection treatment, basically, of the substance. And several years ago, she decided that the real way to treat allergies is the energetic way. So she is now looking at all different energetic trainings, kind of treatments for allergies. She came to my training in Phoenix, And she is this absolutely wonderful, dynamic woman. And she's my manual and some of the other people's from the Energy Psychology Conference. Our information is now in her new book that's going to be coming out, so that all of our stuff is now going mainstream in her books. And she's a very exciting woman. Her vision is to have healing centers all over the world where you go with your whole family in a totally environmentally safe environment, where you go and you get treated all morning, you play in the afternoon, you come back once a year and get tuned up again. And to have these centers everywhere that you can go to, and have places for environmentally ill people that can't take, normal society right now, and to stay until they get healed. So she's really going for it. So I'm just so excited that the work is getting out there. And she dropped her other way of treating completely. And I think she's going to take the energy field way ahead. She just got set up. She's going to be at the Toronto ASAP conference, and she'll be speaking there.
What's her name?
Doris Rapp, R-A-P-P. Her new book that's going to be coming out is called Chemicals, A Wake-Up Call. And it's about how chemicals are really, basically killing our society. So this is from her older book called The Impossible Child. And this is the changes in the drawing of a 3-year-old after he was exposed to milk. So first, this is his drawing, sort of a normal 3-year-old, and then he had some milk, which isn't an unusual thing for a 3-year-old at daycare to have, or something, or at home. And then this is the picture afterwards. And he also became angry, screaming, and irritable. After the treatment, this is the picture after the treatment. What she found is that the energy treatments held better than the injection treatments. So then this is with a 4-year-old with eggs. This is how he wrote his name before he had the egg. Well, actually, she's exposing them with an injection. But this, after exposure to the egg, this is what happened to his handwriting. Can people see? So that's what happened to his handwriting. So, it was, wrong letters first and everything like that. And very red earlobes, and became hyperactive. I'll put this up and then move away. Then this is one in an 8-year-old boy. Before he was exposed to dust, and then exposed to dust, and then after the treatment. But this is what happened when he was exposed to dust, and he's rocking in his seat and kicking on the floor. Now, what happens when this child goes to the library at school? He's not going to be able to function. Then this one is exposure to corn. And I actually saw a videotape of this boy. And this was his picture, and then this is what happened. And he was really awful. He was going like this. He's being like a chicken. He's laying on the floor, putting his feet up on the desk. He was really out of it. Speaking about corn, I was just looking at some of Doris Rapp's tapes. Unfortunately, I can't show them here because we're having this videotape. But on one of the tapes, there was this father who was very choked up talking about his little son. And he had had at least 3 major surgeries for bowel resections and changing in his esophagus and moving all kinds of things around inside. And he almost died twice because of adhesions from different surgeries. And all of that was unnecessary. He had seen Doris Rapp on television, went to her office, and he was completely cured. The problem was he was allergic to corn, and there was corn in every single one of the baby formulas that he was being given. And the child almost died, and the father was in tears. I mean, what he had put the child through for no reason. Okay. So, this is going back to sort of how things are put together. And this is Dr. Dietrich Klinghardt. He's the one who came up with neural therapy, which is another energy kind of work. And he feels that each toxin stored has a specific set of unresolved emotional and spiritual issues that were responsible for trapping the toxin in the first place. So the toxins get stuck in your body, because there was some emotional issue going on at that time. So what I see for you as EFT people is that some substance sensitivities really are just another aspect of the conditioned response to trauma. Just looking at it as another aspect of what's going on during that trauma. So, the sights, sounds, tastes, smells, and textures present in the brain become part of the memory. Present in the brain during the trauma become part of the memory. And then later exposure to those sights, sounds, tastes, smells, or textures bring on that same reaction, the emotional reaction. So I had a patient, another person, I have a lot of people who can't eat many foods, another person who came in and she was very reactive to almost all foods. And what happened was that when you talk about her history, well, the dinner table was always terrible. So that's a big issue, I think, with a lot of people who've had terrible dinner times and then have terrible times with foods when they're adults, is that they've had a lot of trauma at dinner. Well, one time at dinner, her mother got up from the table, ran to the bathroom, and slit her wrist and tried to kill herself. So her connection with food is really not good. So that's an understatement, right? But that is one of the reasons why she cannot handle a lot of different foods. So working on the emotional arena helps clear that. So this is helpful when you're doing some of the EFT, because the body is, I feel, is wrongly identifying the substance as a danger to its existence. It's connecting it up with a danger. And then the body rages an immune system attack to destroy the substance. Some people look at it as a post-traumatic stress disorder kind of thing, and almost saying, I'm going to kill you, kill the substance before you kill me. So when you're doing some of the EFT about it, you may add things like, even though my body thinks, vitamin C is a poison, I deeply and profoundly accept myself. Or you might say, even though my body thinks that any of this food is going to hurt me, I deeply and profoundly accept myself. And you can talk about, the body, thanking the body for being, trying to take care of you. There's some of those kind of aspects that you can use. So a lot of people are interested in the dieting part of it. And the whole thing about that the body holds on to water to dilute the poison, that was just a theory I had for many, many years. And then I found this book called The False Fat Diet by Elson Haas. And it's all documented. I mean, it's like so exciting to have it documented that really the body puts on water weight and gas, it produces gas, as a way to protect the body from a poison, from a substance. So that's one thing. He also talks about why it's hard to really realize that there are so many food allergies out there. Because when people come in, they think, oh, I don't have any food allergies, but when you test them, they really have many more than they think. And the reason for that is that only 2% of food allergies are classic allergies that as soon as you eat the stuff, you have a reaction. 98% is really a delayed reaction. And how that works is that the undigested food leaves the digestive tract, goes into the bloodstream, and then you're getting an immune reaction inside the blood. You're having an IgG immune reaction in your bloodstream, and that's the food reaction you're getting. And that can be delayed. It can be up to 3 days. And it makes it harder to identify a food allergy. Instead of like a respiratory allergy, you'll be around a pollen and your eyes will, start dripping and stuff. The food allergy is more like a bee sting to the entire body. So you get things like depression, anxiety, more global kind of symptoms. So they're harder to pick up. Okay. So he also says that food reactions are, in a sense, toxic reactions. And sometimes the reactive food particles are quickly eliminated, and sometimes they become lodged in tissues and cells. This is real important, because even with food, if the body thinks it's a poison, may take it feels like it's too dangerous to stay in the bloodstream. So it takes it and puts it into the tissues and cells of your body, away from your organs, like in your cellulite and different places. It puts the toxins in those places to try to keep you safe. But the problem is that it's still there. It hasn't allowed it to detox out of your body. And so then your body, your immune system's still fighting it every day. So the short-term solution of getting it out of the bloodstream as fast as possible gives you long-term negative consequences because you're stuck with it for sometimes forever. My thought about this is that if it does it for food, just think of all what it does for really toxic chemicals. So I work with a lot of people with medications they've had in the past, for exposures to different things they've had in the past, for infections they've had in the past, because my belief is that it's still stuck in our body. So, as we had said, any symptom can be caused by an allergy-like reaction. Also, any substance can cause an allergy-like reaction. So any substance can cause something. In my manuals, both of them, I have lots of lists. And I have lists so you guys don't have to reinvent the wheel. You can just go down lists, check things, think about things, do some detective work with things. And so this is Dr. Devi Nambujapad's, her top 10 allergies. And you'll see when it comes to the ones I use about the first 6 or so of these. The reason you want to work with egg and chicken first, I always check people on egg and chicken. It's closest to the protein in our bodies. And you don't want to be allergic to the protein in your body. So you want to be clear on that. The next thing is calcium mix. You want to be okay with calcium because you know why? If you're not okay with a substance, if you're weak on a substance, you're not absorbing it. So all the calcium that so many people are taking, you may not, if you're weak on it, you're not absorbing it. And I think there's going to be a huge upcry 20 years from now, all the women who've been taking calcium for all these years, and most of the women I check are weak on calcium. They're not absorbing it at all. So they're not getting any of the benefits. Vitamin C mix, you need it for the immune system, B complex for the brain and the nervous system. The reason she starts with these things is saying you've got to strengthen the body so that it can handle other substances. But let's strengthen the body so it can really use these nutrients, can utilize them. So, and then I have lists of things like Gary's. Gary has, these are the ones that he came up with as the top toxins: perfume, different herbs, caffeine, coffee. Okay, so in my manual, I'm serious, there's lists of pages with hundreds of things on it. You don't have to know what half of the things, you don't have to know what they mean. You just test for them. So I had somebody ask me about, so I'm using muscle testing, if there's some other ways to test if people aren't proficient in the muscle testing. When I get to working with somebody, I'll do that. I just realized that. Okay? I'll talk about some other ways. So when we're looking, so we've got lots of possibilities of things, but we now have to start tracking for the cause. Is it inside the house? Everything's suspect. What are we going to start treating? What are we going to start looking for? Is the cause inside the house? Is it outside? Is it food? And so you need to be a detective. It's kind of like Gary saying, he's looking for different aspects in being a detective. So you need to ask, when do the reactions occur? Time of the day, different seasons. When did they begin? What was going on in your life when they began? Did you have some emotional things going on at that time? Were you going through some traumas at that time in your life? Did you change jobs? Did you just get over, a common one is just getting over an infection. And my guess is it's not really over. And were you exposed to something? Did you take a medication that you had an adverse reaction to? That's probably still in your body right now. When do you feel good? And again, where do they occur? And what foods do you like to eat? Unfortunately, the foods that we're addicted to, we're usually allergic to. And that's across the board. If someone says, oh, don't take my popcorn away, big red flags, you don't have to do muscle testing. You just treat them for that, because usually what we're addicted to, we're allergic to. And the reason for that is because it really isn't like any other addiction. You're getting kind of a high on that food, and then your body sort of starts winding down, and then you want another high, because it's causing some almost poison kind of reactions in you. What do you like to do? What kind of activities? What do you like to wear? If someone comes in to see me with like 12 silver bracelets and silver things all over, my first thought is, let's test her silver or her gold or whatever she's got on, because if you're drawn to those things, you're usually allergic to those things also. Did someone ask a question? Oh. People can ask questions, if you want to get up and ask questions. Past history, I also look at past history in your childhood, your work, your environmental exposure. Somebody I was just talking to, he had been exposed to all kinds of toxic industrial cleaning chemicals, which are really bad. So that was my first thought of where to go with him. You just listen to what people are saying. And my feeling is the EFT practitioners make the best detectives, because you're already used to listening for the different aspects. And so I just want to give you some examples of things how my mind works. I had a patient come in, and her complaint, and this was a very serious complaint for her, is that her eyes would tear constantly. Just tear. Beyond anything I had ever seen before. She had a handkerchief that was like this big, and it was tearing all the time. And she was very wealthy and went to these balls and these cotillions. She was like society lady, and she couldn't wear her makeup, and she couldn't dress the way, she just was very upset about this. And this has been going on for 20 years, and she had been to all the best allergists everywhere. And we were talking, which is what you guys are comfortable doing. It's talking and just finding out what's the history, what's going on. Turned out that 20 years before, she had been in a car accident. And it was so bad that her eye had to be rebuilt with plastic, and her jaw, here and here, was rebuilt with metal. Well, that seems like a good thing to try. So now if you weren't muscle testing, I would just treat for the plastic and the metal. If you're muscle testing, I took my little vial for plastic and put it by the eye, because that's one of the things I do, and you can do it even if you're doing EFT, and if even if you're not muscle testing. You just put the piece of paper with the name of the substance on the place of the problem. I think it brings the energy more specific to that place. That's one of the things I do that some of the other people don't do. So I put the plastic vial on her eye, and I muscle tested and was weak, and then I did a treatment. And then what I did is I moved it till it muscle tested weak again. And then I treated it again. And I muscle tested, and I move it until it's weak, and I treated it again. I did the same thing with the metal vial for down here. I moved it and treated, and moved it and treated. And what happened is the next week, her tearing had gone down 50%. And then we treated one more time, she went home, and the next time it was gone completely. So that kind of listening to her history is what EFT people are used to doing, which some of these allergists, I'm sure, never thought to think about stuff like that. Another one was a little girl who came in. She was 11 years old, and she had migraines, 8 or 10 migraines a month. And in the course of just the schmoozing, you're just finding out information, you're just talking, and I'm checking her for other things, but I'm just talking to the family. Turns out when she was 2.5 years old, she had conjunctivitis that turned into cellulitis. Well, I don't know exactly what that is, so I just figured it was some kind of infection. So you don't have to get scared by me saying words like that. You just assume it's some kind of an infection. And when I checked, it found out it was a staph infection. I have all these different vials. And I put it on the eye where she had had the conjunctivitis. And again, I checked it, and where it was weak, I cleared it. Checked it, weak, I cleared it. And the next week she came back, and she said, it was interesting, she said just by putting the vial, and these vials, by the way, have the electromagnetic energy of the substance. So there's nothing in here like a, you know, I don't have staph in here, staphylococcus infection or something in here. I have the energy, it's the frequency of it. So just by putting that by her eye, she had eye pain. And it was like, I wish she had told me. I mean, I didn't really want her to be in pain. But the next time I retreated it on the second visit, and her migraines all went away. So from 8 to 10 a month, they were all gone. And what she had is the energetic memory, I believe, of that infection still in her body. So when we're treating with EFT, we're treating the energetic memory of some of these things.